Hello, today we're going to talk about upper and mid back pain, which is something very common that people come to see me with frequently. There are two basic types of causes for these pain. One is an activity or an action-related cause, and the other is more passive, such as posture and stress. So we'll talk about those causes, but basically when we say upper mid back pain, we're talking about pain along the shoulder ridge here, but we may also be talking about pain along the scapula. So the scapula is what we call our shoulder blade in the back, and we may have pain that is right down into the mid-back area between the shoulder blades. The third type of pain is rib pain. And what I want you to appreciate here is that the spine has little ribs that come out. I hope you can appreciate this. And the ribs come in and they attach to these little outcroppings. And at times, that rib will displace itself from its attachment at the spine. So those are the three main types of upper and mid-back pain and the causes that will bring them on. Activities. So active or action activities that bring people into my office will typically include swinging a golf club, and you can appreciate the fact that repetitively swinging that golf club makes that scapula move in and out and in and out repetitively, and there's muscles and ligaments and tendons attached to that muscle or that scapula that try and allow it to move and hold it in place all at the same time. And there may be an injury because of that. Surfing will be another one with the repetitive overhand movement. People now are doing a lot of CrossFit training, and CrossFit where they're grasping above shoulder level and pulling up, and then doing push-ups which push the shoulder joints up into the upper back area may be another cause. Obviously, weightlifters working out and long-distance runners. If you think about long-distance runners, the shoulders are elevated and the hands are up in this position for long periods of time, and that may also contribute to pain about the upper trap ridges and into the upper and mid back. The next type would be bending, stooping, twisting. So a lot of people will say, I went to pick up my 20-pound child and I bent and I twisted and I lifted them and I moved. That combination of motions may displace this rib. And when the rib pops out, typically the patient will come into me in a great deal of pain. They'll say, it hurts to take a deep breath. It feels like somebody stabbed me in the back. And what they're typically relating to me is that one of these rib heads has displaced itself and we need to put it back. So how do we treat all this? Well, if it's passive from something like stress or posture, which when you think about your posture and you round your back, especially with older people, the back will be rounded and for long periods of time, and those people will typically have mid-back pain. Excuse me. So we need to change postural profiles of these people, and we need to give you some exercises that will help relieve that forward flex posture and bring you into a more physiologically appropriate posture. We may also give you things called doorway exercises that help stretch these posterior muscles that are very hard to get to. And then we will do chiropractic manipulation to the spine from the base of the neck to the bottom of the shoulder blades. And this will give movement to these joints. The movement will allow the muscles to flex and contract more appropriately and relieve pain that way. The rib head, if the rib has been displaced, will simply reduce or put the rib back into place and then prescribe some rest so that healing can occur. So there's what we're talking about with upper and mid back pain. And in the future, we'll describe other causes and symptoms. But for now, if any of these sound like you, give us a call and we'd be happy to talk with you or see you.